Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And joining us in the studio to talk about this condition is Raniah Bogari, a skin specialist who treats hyperhidrosis. Welcome to the show. Hi. Dr. Bogari, what makes certain people sweat too much?
Well, actually, sweating is a very important function in the body to regulate the temperature. But in some cases, you have the people who have the hyperhidrosis. It can be like a primary hyperhidrosis where you don't find a reason for the sweating, or you have the secondary hyperhidrosis, which is most of the time in combination with some medical treatments or like illnesses, diseases which can occur then.
So what kind of diseases? I mean, the thyroid gland, for instance, is one of these things.
Or like diabetes, or like if you have some tumors also, it's like the be symptomatic cold. They sweat cold sweats in the night, and they have other symptoms. So it's very important if a patient comes to you to the praxis that you see what kind of sweating do you have here. Should I say, okay, it's a primary sweating, or should I make other diagnostic like control from some other functions also?
So for the patient, it's important as well to go and see a doctor if the patient sweats too much, because there could be an underlying cause.
Yes, of course, right. Because, yeah.
And if there's no cause for the sweating, so it's a primary sweating, what's the problem with it anyway? I mean, is it just a cosmetic problem, a psychological problem, or are there any health issues combined with that?
Well, I think most of the time you have a very high psychological problem, because these patients who are suffering on this excessive sweating, they're really suffering in their daily lives. They have difficulties with their relationships with others, with their friends, also in the jobs, like if they have a presentation, or if they have like also students, they can't write their exams because they're sweating excessively on the hands, and it's a really difficult situation for these people.
It's a big psychological problem.
Yes,
then.
it's a very big psychological problems. There are also the studies which showed that the patients who suffer on hyperhydration has more psychological problems than others, like they have other diseases on the skin.
I mean, removing all the sweat glands is a nice idea, because if there are no glands, you cannot sweat. But are there any long-term effects or risks with that operation?
I think that the problem is that you can't remove all the glands on the area, because you just like don't see the glands. You do like a liposuction on the area where you're sweating, and this is the effect that you sweat less. But sometimes it's a problem because you still sweat on this area, and it's like not enough. And it's also an operation, and the operation has its risks, because you may like have an infection on this area, and that's why I advise to go to a specialist who does this operation lots of the time.
Yeah, just let the specialist do this, because he knows or she knows what she's doing.
Yeah.
I remember a patient in my office who was sweating excessively on the hands, and they didn't remove any glands, they just clipped the nerves. So they destroyed the nerve in the armpit, and so this patient wasn't sweating any longer in the hands.
Yeah, this is a real I would say it's not the first treatment I would recommend, because there are some other ways to treat the sweating on the hands. But if all other ways don't give the effective result, so you can recommend this operation if they're really suffering under it, because it's also a big operation which should be done in a center, because you can also cut some other nerves, and then you have other diseases or like the Horner's syndrome.
Yeah.
So I don't think that it's really the first...
So it's not only the good nerve damage, you can even remove some beneficial work of the nerves. And this kind of patient I had, he was sweating on the hands, and after they cut the nerves, the sweating stopped on the hands, but he was sweating more excessively on the rest part of his body. Is that a usual thing?
These are the side effects. Or this is the most side effect, that these people are very happy at first, because like they're not sweating more on the hands, but then they sweat all over the body. So, yeah.
So it's not very beneficial then?
I think, yeah.
What about Botox? You can just give this kind of nerve poison into the glands? Or what
yes,
do you do?
you'll just like... Botox is really a very good treatment for sweating because you can give it all over in each area of the body. You can use it. And most of the time you use it for under the arms because it goes really fast and you see the results after 3-4 days and the patients are really happy about this. Well, if you're sweating on the arms or on the feet, it's a little bit more difficult, I see, because they have more pain. But if you do a local anesthesia before, the patients tolerate this and they're also happy about the results. So it's a really very good
But it's a kind of intervention. I mean, it's not a surgery, but it's intervention. But what about the household things? Our viewer Limba Yebor Boteng from Ghana wants to know which kind of antiperspirants she should use.
Yeah. I would say the antiperspirants are usually the first treatment which most of the patients, because they're going in internet and they're searching and most of the time you have these prescriptions with aluminium chloride and they have to use it on the area. Most of the time it works very good under the arms, but it's sometimes difficult for the hands and for the feet. So you have to see the concentration of aluminium chloride because it sometimes irritates the skin when you have a very concentrated solution, and you have to use it at night before you go to sleep. You have to wash the area before. And I think if you use it in the right way, it will help you, but not 100%.
And if you don't want to just go into a shop and buy something, go and see your doctor and get a prescription for that.
I think you should go and see the doctor.
Thanks so much for being with us in the studio. Thank you.